Good afternoon, everybody. Thank you so much for joining us for today's webinar, Dementia Care Preparedness Initiative Summary of Findings, co-hosted by Ontario CLRI and Family Councils Ontario. My name is Tian Zhang, and I'm the Bilingual Events Manager at FCO, and I'll be your host for today's webinar. Before we start, I would like to take a moment to recognize the land on which we are gathered today. I am joining from Toronto, which is seated on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. And now a few housekeeping rules. If you have been to our webinar before, this isn't anything new to you, but those who might be joining us for the first time, welcome. You'll notice that everybody is in listen-only mode right now. You'll have time at the end for an interactive question and answer period with our guest speaker. I invite you to use the Q&A box to ask your questions. You can ask your questions all throughout the presentation, and we will get to it at the very end. If you are more comfortable asking a question by audio, you can raise your hand and then I will give you the feature to turn on your microphone if you're more comfortable with that. So you can use the Q&A box to ask your questions, and there's also a chat box if you want to just, share your feelings, your thoughts, chat amongst us. I'll be monitoring the chat throughout the session, so you're more than welcome to use that as well. If you have any technical questions or questions for Family Council Ontario, you can also use the chat to ask those questions and I will answer it. You'll notice that this webinar is being recorded, so we try to record most of our webinars so that it's available. If you want to view it afterwards, if you want to share it with anybody in your sector, in your surrounding, you're more than welcome to. It will be available on Family Council's Ontario YouTube channel next week. And if you haven't subscribed to FCO's weekly e-bulletin, I welcome you to do so. You can visit fco.ngo and it's on our main page. I'll also share it in the chat, but it's to stay updated with all the new resources and events that we have. So it is my pleasure to introduce today's guest speaker, Alma Lekic. Alma is a gerontology professional committed to supporting the quality of care of older adults. Alma has worked in various roles and settings, including teaching several gerontology courses at the local community colleges. As a knowledge broker, Alma worked on the Dementia Care Preparedness Initiative, supporting knowledge exchange and collaboration across care providers and organization. I am now passing the floor to Alma.
Thank you so much for the introduction, and thank you for joining us today, everybody. It's a pleasure to be here. I'm just going to share my screen and then we can get started with the presentation. Um, so we'll be talking a little bit about the Dementia Care Preparedness Initiative. I'm going to review of what the program was, what it entailed, and then also share some of the results with you. So, there was many findings and results in this, but I've kind of customized it to, I think, maybe the interests of this group, because otherwise it would have been much a very detailed and a long presentation, because there were many questions that were asked to the sector. So welcome everybody. So I'm coming from Ontario CLRI, and I'm just going to go over what we do. So Ontario CLRI provides education and resources to long-term care homes, and we have three locations. I'm located at Baycrest. We also have a location in Waterloo at the RIA, and also up in Ottawa at Briere. So yeah, maybe you've heard of us. But we work together with the sector and with other community partners to provide beneficial resources to long-term care home team members. So our mission is a provincial resource that in partnership builds capacity in long-term care through education, research, and knowledge mobilization. Our mission is a long-term care continuum with capacity to support every life well lived. And our values are quality, collaboration, accountability, sustainable change, equity, and diversity. And as I mentioned, the three host sites that we kind of work with. So some of our programs are programs across all three sites, and then our other programs can be site specific. So our strategic impacts is to engage and train current and future workforce, to enhance care through collaboration and knowledge mobilization, to support research and innovation, and be an effective resource for the long-term care sector. Dementia Care Preparedness Initiative. So this was the Ontario Ministry of Health and Long-Term Care funded program that took place last year in January, so January 2025 till the end of March in 2025. So it was a 3-month program that wanted to measure and assess, it kind of wanted to assess the readiness of long-term care homes to implement an organized dementia care model. So what we did is we supported long-term care homes with this and an online preparedness assessment. Then there was an interview process where 30 homes were interviewed on a one-to-one basis or a small focused group. Some of the homes that fully participated, they received a personalized readiness report that included some benchmarking information between different homes and kind of where they stood when we were looking at dementia care in the province. 301 LTC homes, they consented and registered. So this was really great participation considering it was a really short program. We summarized the data for 270 LTC homes, and also 274 homes received a home preparedness profile. And this was shared with the homes in June and July of last year. We sent a project report to the ministry also on around June 30th of last year. And we're currently have developed a snapshot infographic which summarizes the findings, and we're going to have that on our website available very soon in the next couple of weeks. So that's a public facing document, and it has a lot of the findings from this initiative. What we found is that there was varying phases of readiness with large number of homes that were applying a specific approach, that the approaches were rooted in person-centered care, and that there's also many different models being utilized in the sector. We asked homes, about their future aspirations as well, so we'll share some of that with you today. The online assessment, it was a strengths-based assessment that included 30 questions. We asked homes about their current dementia care practices, education and training, and we also asked them for their future kind of visions of dementia care in their home and in the province. And then when we met with them in the interviews, we did a deeper dive into some of those areas. This is the DCPI participation across Ontario Health Region. So just keeping in mind that some regions have more homes than others, but you can see here that Central Region, there was 44 homes who completed the assessment. East Region, there was 68. Northeast, 18. Northwest, 8. Toronto, 40. And then the West Region, 96. We asked homes to identify which stage of implementation phases they were in. So you can see here a lot of homes, 99 homes were in the initial implementation phase. Then we had 66 home in the installation phase, exploration, 55 homes, and then full implementation, 54 homes, which means that 54 homes across Ontario that participated in this initiative have fully implemented a dementia care program. These numbers were used recently. Ontario Health had funding available for dementia care for 15 homes in Ontario. It's a pilot project that is sponsored by the ministry, but it's filtered out through Ontario Health. So this was one of the questions the homes were asked when they were applying for this funding. And this dementia care funding is allocated to 15 homes in Ontario. When we asked about different dementia care approaches, homes shared, this is what they shared. So the most common program that's currently being used is the Ontario Five-Star program with 204 homes using this type of a program. We have Montessori methods. That was the next kind of more popular one. So there was 168 homes that are using Montessori methods. There's person-centered language series with 119 homes using that. Advanced gerontological education with 101 homes that are using that. And then positive approaches to care with 100 homes that are using that. Some homes have developed their customized models of dementia care program, and other homes are using kind of several approaches at the same time as well. Um, this was engagement of residents, caregivers, and volunteers. So we asked the leadership completing this assessment to kind of assess themselves in terms of education and training. So the first assessment point was here that caregivers receive adequate training in dementia care. So homes had to choose positive, neutral, or negative. And here you can see that 22.3% of homes felt positive about caregivers receiving adequate training in dementia care. 28.1% felt neutral, and 49.6 felt negative. Um, so that's for caregivers. For volunteers, the volunteers receive adequate training in dementia care. 20.1% of homes felt positive, 29.9 felt neutral, and 50% felt negative. And then here, the resident and caregiver outcomes are used to inform home level decision making. So 87.2% of homes felt positive that this was happening, 9.5 felt neutral, and 3.3 felt negative. So this, even though this was a strengths-based assessment, in the profile preparedness that some of the homes received, this was an identified area. This was a kind of we called it an actionable insight. So this was an area that the homes could look at and possibly determine what the next steps would be in terms of education and training for residents and volunteers and caregivers. Because in the assessment, these numbers are quite low. So I think that there is a lot more probably the homes could be doing in terms of orientation and training, and sharing some of the dementia care practices that are happening in the home on the caregiver and volunteer level. When we asked homes about their 10-year vision, they shared things like a person-centered home-like environment. They wanted a safe and supportive physical environment, a sense of community, residents' agency and engagement. They thought potential role of technology supports would be beneficial, and a holistic approach to care. Then there was the next theme was kind of around staffing, having all staff educated and trained in dementia care. They thought having sufficient staffing levels, one-to-one care, high staff to resident ratio. And then there was theme around impact, anticipated positive impact on their residents' well-being, and anticipated a change in general public perception of dementia and LTC. Some of the leaders in the homes felt that because of the media, there were so many negative connotations with long-term care, and that when families and residents were moving into long-term care, because of this negative perception, they were already at a mistrust with the home. So, it was kind of that the homes had to work hard to develop that trust with families and residents that were moving into the home. This is also what we heard from homes. Some of the facilitators to support their future vision, to have implementation coaching, mentorship, and peer support for leaders, to have new dedicated dementia care coordinators, to have built environmental changes, spaces, room, colors, sound, and lighting, and also setting up the environment to facilitate engagement and impact the quality of life. Furthermore, they felt additional clinical staff, mealtime assistance, staffing ratios, education and training of team, volunteer, and caregivers, integration with the community, and then the general awareness and perception. Before I wrap up what's next for Ontario CLRI, I think by conducting this assessment, it was really evident that there's a lot of um, compassion and dedication and effort happening on the home level in terms of dementia care, in terms of compassionate and person-centered dementia care in the homes. But I think some of these ideas and themes that we've identified as kind of further opportunities for work or considerations were also identified by the homes. So as I mentioned here, we're working on a public document that will be shared later this month. Our team did present the findings at This is Long-Term Care, and then we're currently looking of ways to support the sector with dementia care planning. Um, I believe that's the end of my presentation, so I'm happy to answer any questions. I'll stop sharing here. I see there's something in the Q&A. Okay. How do we find out if our home took part? I think you can ask the home's administrators or the director of care if they participated. I think that would be the best way to kind of approach that. My observation over past 3.5 years with a parent in a long-term care facility is that there was great fanfare through the implementation stage. However, there's absolutely inadequate attention investment in sustaining the practice. This is especially concerning given the turnover in staffing and new residents' families admitted who now have no idea what this program is about. Okay. Thank you for sharing that. I'm not sure in terms of how to answer that. I don't know if there was anything that can be done from like a family council perspective where some of that information can be shared to new members. But hopefully there's there seems to be a lot of focus on dementia care right now with Ontario Health and with the Ministry of Health and Long-Term Care. So hopefully that homes will have the resources to kind of to implement and sustain models and have better education and training for all who are involved. Um, For homes that did not get accepted for funding, do you have recommendations for educational opportunities for staff and for family? There is some resources with Ontario CLRI. I recommend that, have a look at it. And we are currently kind of looking in different ways that we could support the homes so that including families and caregivers and team members who are working in long-term care. Is there a way to find out who and where the 15 homes that were successful in dementia care preparedness funding application? That's through Ontario Health. So that is a dementia care program. I think there will be a public announcement coming up. So just stay tuned for that. Maybe once I hear something, I can share it with Taiyuan, and then if you want to share it with the family members. But I believe there will be a public announcement from the government, from the ministry. There needs to be greater effort to sustaining and not just implementation. Yeah.
Thank you so much, Alma. I'm just waiting to see if we have any other questions coming in. Please feel free. Just looking at the chat, there isn't anything on the chat either. If people have questions that come up, would it be better for them to send them to me and then I can maybe forward it to you? Or do you have a contact that we can contact you directly? What do you prefer?
Um, well, I guess depends of the nature of the question, maybe through
Right.
you, and then you could kind of
Yeah,
see.
sure.
Yeah, the program,
The pub.
the public documentation. I'm not sure how the ministry will share that public documentation, but if I do hear, if I see it, if I happen to see it or hear about it, I'm happy to share it. Um, the homes were aware, like the Dementia Care Preparedness Initiative. We did, the homes did receive information about this program, but I think it just depends of where they were at that time. Like it was a pretty short, it was a 3-month initiative. So, depending, I think, on the home, but considering that it was a 3-month initiative, having kind of half the sector participate in the program was very beneficial. It was a good base, a database to kind of to begin with, and I mean we're hoping there will be more support for dementia care in the coming years. But we're not 100% on that. I know we're just looking for ways now that we can continue supporting the sector with dementia care, and perhaps that includes um, perhaps that includes, working with the family councils of Ontario and figuring out if there's something that we can collaborate on and how we can support the families with the dementia care in the homes. Um, the total number, I believe it's around, this is approximate 630, but I know there's more homes that are being developed, so I'd have to look up that number exactly, but I know it's around 630 homes across Ontario. There could be more though. When was this program being introduced? So it was January 1st of last year. Pardon me, it was January 13th when we actually launched it.
Any other questions? I think, yes, the more we talk about it, people kind of come up.
Questions come up. Yeah,
Mhm.
yeah.
But yeah, if you have any other questions, like you're absolutely welcome to email them to me, and then I can pass it to Alma. And if there's any resources or documents or updates to share, Alma, you can send it to me as well, and then I will forward it to everybody present here, and we'll share it in our e-bulletin as well. Another
That's
question.
good. Yeah. I mean, the home, I'm suggesting you can also ask the homes if they applied for that dementia care funding and if they've received it. The homes that applied, they've heard back, like the homes know whether or not they received it. It's only 15 homes every year. And year one of the program is already, it's from January of this year till March 31st of this year. So it's a very kind of short fiscal year. It's just the first quarter of the year. And then I believe there will be a round two of applications, but that's more like that's through Ontario Health. We're not really Ontario CLRI is not really involved in that. But I think as a family council, you can definitely ask the home if they've received that funding and what they plan to do with it. Are there any results that surprised you or were unexpected? In terms of the assessment, I guess maybe some of the training, especially with maybe with volunteers like that, I think was surprising. I think we kind of had thought that maybe the volunteers, um, that they would be getting dementia care training. And I know some are, but I think that was a low percentage. So I think that was kind of surprising. What else? But everything else was, I think, it wasn't surprising. I think that through these assessments and the interviews and the focus group, I think the compassion and the commitment of long-term care leaders and team members, it was very evident. And even though the government had announced that homes ha should have a dementia care program or should have an organized dementia care program, so many homes already have had some type of a program or some type of an approach. So, this wasn't new to the homes by any means, but it's always good to get that kind of support and education and resources and funding to strengthen that and to elevate that. Um, yeah, I'm not sure about the Ontario Health Program. I think that would be best to kind of try and see what the um like uh, what the recommendations will be when the funding stream opens again. Yeah, I'm not sure. I'm not sorry. I'm not because I'm not really involved in that program. Like that's through the ministry in Ontario Health. Um yeah. What are the differences of the role before? Okay. I think a dementia care coordinator would kind of oversee the dementia program in the home. So, I mean, it would be up to the homes and how they want to implement that. Whereas someone who is working between behaviors, I think they're mostly focused on responsive behaviors. But I think a dementia care coordinator, which some of the homes that did apply for this funding are able to use, I think, the funds to have a dementia care coordinator would be kind of somebody who can make sure that there's an organized program, that everybody knows about it, that there's training and evaluation so that it is more sustainable. It's somebody who could really speak to the dementia care program in the home and what's happening on all levels.
Waiting to see if you have any more questions. Is there anything, Alma, that you want to, address before we kind of, if we're not getting any more
Um,
questions, to close it
no,
out?
we'll share like the snapshot resource that I was kind of referring to. Once that's up and live on our website, I can share it with you and you can share with our members because that kind of has a bit more detailed information. It has some of the information that I covered today, but you'll kind of be able to see it at a glance. So I think that's like helpful for people to see it.
Perfect. So I'm not seeing any more questions come in, but if there's any other questions, okay. Thank you for this. Thank you so much.
Thank you. Thank you so
Um,
much. It's a pleasure to share some of the findings. um
mhm.
to share some of the findings with you, and I really hope that there will be some work possibly that we can better support the families with dementia care that are in long-term care as well. So
Absolutely. Thank you so much, Alma, for being a guest speaker today, for bringing all of this information to our long-term care audience and our families. Um, can you share a link to the report in the chat? Someone's asking.
once it's available, I can send it. It's not quite yet. We're just like it will be another like probably yeah, say definitely by the end of February we will have it available. So I'm happy I can share it with you, and then you can
Please.
email it to members. Yeah.
Absolutely, that'd be great. Thank you. And yes, this webinar has been recorded. So if you would like to, if you joined late, if you want to view the first part, it will be available on Family Council's Ontario YouTube channel next week. And all of the updates and documents that we talked about, like any new information that we have to share, it will be on Family Council's Ontario weekly e-bulletin that goes out every Wednesday. So feel free to make sure you're subscribed so you are updated with all of the new information. And thank you so much, Alma, once again. And thank you to our audience for always being present and asking such good questions. Stay tuned for Family Councils Ontario's next events. And thank you and have a good rest of the day, everybody.
Thank you so much.
Yeah.
Bye bye.